Good morning, guys. I hope we're all sparkly. I've been a medical doctor now for over 25 years. So I started medical school back in 1992, qualified in 1997. At that time, I thought I knew everything. I was ready to take on the world. Little did I know, I knew nothing. I walked onto that ward for the first time and realised, oops, all that academic knowledge, I need to now apply it clinically and treat you, the patient, not read a textbook, not just read the papers. Data is data. It's useful, but you've got to be able to apply it clinically. And you don't just go on one paper. There is weighted evidence. You've got to think how robust that evidence is and whether it's translatable in real life. So it's been a continual learning journey. Oh my word. So it's frustrating to see these experts on the internet talk with confidence but not really understand the basics. Because the first 5 years of medical school, you are learning, you're going deep into physiology, pharmacology, anatomy, biochemistry, the list goes on. So there was a recent video about, does estradiol raise prolactin? Now, the first thing to understand is that hormones are essentially chemical messengers that help facilitate the function of their target organ. They are never independent. Whether they work directly with another hormone or indirectly, it's all a wonderful amount of hormones that are working for and against you. So we could take the breast as a good example. We know that estradiol is excitatory and testosterone is inhibitory. So breast tissue development, excess estradiol compared to testosterone. We could take the uterus. So we know that, again, estradiol is proliferative to uterine lining and the progesterone maintains that lining, which is obviously why when the progesterone drops, women menstruate. So everything affects everything. So with healthy hormone levels, things should be balanced. There is an equilibrium. We need to understand about yin yang. You can't have harmony without contrast, and nothing is independent. So yeah, estradiol, does it raise prolactin? Not if it's balanced. If estradiol is raised, this is basic pathophysiology. If estradiol is raised, it inhibits prolactin inhibitory hormone in the arcuate nucleus of the hypothalamus, aka dopamine. So you do get a rise of prolactin. Internet experts, wonderful, aren't they? Estradiol also has a direct effect on the pituitary. So again, does excess estradiol raise prolactin? Yes. Now, what might be the reason? Well, physiology is pretty complicated, isn't it? Excess estradiol raising prolactin. Well, perhaps we might postulate that testosterone's relationship with dopamine has a positive effect on libido. Yep. Reward as well. Yep. Prolactin goes up in stress states. So it gets even more complicated. So why have we got this raised estradiol? We've got this raised estradiol as a result of having too much expression of the aromatase enzyme, whether that's because of liver dysregulation or just too much aromatase enzyme if you're a chunky monkey. So is there a reason why raised estradiol raises prolactin? Don't know. Put your answers in the comments. It's interesting. We know that raised prolactin is negative on your ability to copulate again. We know that raised prolactin, the post-refractory period, is as a result of raised prolactin. So you're not supposed to have sex straight away. Obviously, the primary function of sex is to procreate, and there's no point having sex straight away if you've already copulated. Interesting, isn't it? But the basics are the basics. You learn this at medical school, and then you continually learn during your clinical experience as a doctor through continued professional development, seeing you, the patient, and being able to apply your knowledge clinically and then adapt your knowledge to the best of the patient. So we often see a rise in estradiol causing a rise in prolactin if the estradiol is raised. Now, this cohort of people that don't understand physiology, they don't even measure estradiol. So how can they know if estradiol raises prolactin? Convenient, isn't it? How can you have an opinion on something that you don't even measure? There are so many pseudo intellectuals out there. So, if everything's in balance, there should not be a deleterious outcome. If things are distorted, then there will be. So treating estradiol, again, a big can of worms that we've spoken about numerous times. If we do see a rise in prolactin associated with a rise in estradiol, that lends more weight to the fact, yes, you do need to control estradiol. Now, obviously, what you should be doing is looking to optimize your liver health and reduce body fat. But we do live in a poisonous world. So again, you can't apply dogma and the facts to real life. Life is a little bit more complicated than that. You need to take everything into consideration. And as a doctor, you should do that. As somebody who's read a few papers and then spouts nonsense on the internet, well, you don't know what you're talking about, do you? Disappointing. Say things with confidence, people believe you. Clinically, doesn't work. So, evidence informed, as my colleague wonderfully phrased it. Take the data, take your understanding of physiology, pharmacology, blah, blah, blah. Take the experience with the patient and always look to act in the best interests of the patient. Eyes wide open when making the choice about who you trust, who you believe. Have a great day, guys, and go earn your reward.